COVID-19 is still spreading in Georgia. Now get facts, not fear, at 11alive.com/COVID numbers. Track cases by county using our interactive map and get the latest health department data. Visit 11alive.com/COVID numbers.
A sign of relief across half the nation. The rest feeling devastation.
In Georgia, we can now focus on the 2 Senate races here that are still unresolved.
It's not over yet. You can still make history. The balance of power in Georgia voters' hands, whatever side you take, could determine the nation's fate. Your vote still matters. Stay involved, stay informed with journalism that gives you a real voice.
Breaking news, the hand tally of nearly 5 million votes is now complete.
Right now, no matter how you add it up, our cases are rising.
We do have a flash flood warning that just popped up here.
The hand retally, that's done. This is going to a recount, and the taxpayers will foot the bill for a 3rd time.
Morning news should be both informative and fun.
Gone are the days where we're speaking at you. On Morning Rush, we're speaking with you.
So connect with us. Talk to us. Think of it as a conversation.
Morning Rush weekdays 5 to 7 on 11 Alive.
Quick, open your phone camera right now, aim it at the screen to download 11 Alive's new and improved app. This QR code will take you to the App Store or Google Play. One simple tap gives you enhanced radar, street-level zoom, and severe weather alerts. It's just that easy.
As COVID-19 continues to impact our state, the need for food is bigger than ever.
In fact, 1 in 4 kids in Metro Atlanta live in a home that lacks access to adequate food.
But here's how we can take action to help.
The next time you're shopping, grab some extra canned goods.
And drop them off at 11 Alive's Canathon with contactless drop-off December 4th.
Or visit 11alive.com/Canathon for 3 easy digital ways to give.
11 Alive's annual Canathon. With your help, we can stamp out hunger in Atlanta.
Morning news should be informative and fun.
Yeah, and we do that here on Morning Rush with Verify, Connect the Dots, Why Guy, and more.
We love learning about new things and sharing them with you.
We make the news make sense.
Morning Rush, weekdays 5 to 7 on 11 Alive.
The Negro people had to leave. They were told to get out.
White only, no black!
1912, all but one issue has been erased.
We haven't had none up here since the 1st of the century.
What's the importance of making sure this history isn't erased?
So that it doesn't happen again.
Is your morning routine feeling a little routine?
Then mix it up.
Morning Rush is different.
It's the fast-paced news you need
With all the energy of your morning coffee.
Come see the difference on Morning Rush weekdays on 11 Alive.
Weather can't run from the all-new 11 Alive Thunder Truck, a mobile weather center with the power and speed to chase down the strongest storms and bring you on-the-ground conditions. The 11 Alive Thunder Truck, sponsored by Landmark Ram.
Here in Atlanta, bad weather means bad traffic. A few drops of rain could destroy a commute. But that's where my man Crash Clark comes in. I go street level, he goes next level. Together, we make sure you get to work on time. Morning Rush, weekdays 5 to 7 on 11 Alive. Hey, quick, open up your phone camera right now. Aim it at the screen to download 11 Alive's new and improved app. This QR code will take you right to the App Store or Google Play. One simple tap gives you enhanced radar, street-level zoom, and severe weather alerts. It's just that easy.
Journalism that gives you a real voice.
At Morning Rush, that's our commitment each and every day.
And why we're honored to have been recognized for Best Morning Newscast for the 2nd year in a row.
If you haven't yet, check us out. See why we're where Atlanta speaks.
Atlanta roads are my thing. ITP, OTP, Ponce, Piedmont, all the peach trees. Combined with Chesley's street level forecast, that's a lot of tech and experience to help your commute.
Morning Rush, weekdays 5 to 7 on 11 Alive.
We're quite the combo.
The President of the United States was accusing you of voter fraud.
Oh, I know it, and I knew it wasn't fraud.
Mr. James Blaylock voted in the election, the president's campaign tweeted. The only problem, he passed away 14 years ago. False. James Blaylock did not vote. Mrs. James Blaylock voted.
After our investigation, national news outlets owned up to their false claims, and the president's campaign deleted the tweet.
Weather changes can make or break your day. That's why the 11 Alive Storm Trackers are always watching what's coming next, delivering accessible and accurate forecasts that prepare you, not scare you. For Storm Trackers, only on 11 Alive.
COVID-19 is still spreading in Georgia. Now get facts, not fear, at 11alive.com/COVID numbers. Track cases by county using our interactive map and get the latest health department data. Visit 11alive.com/COVID numbers.
A sign of relief across half the nation. The rest feeling devastation.
In Georgia, we can now focus on the 2 Senate races here that are still unresolved.
It's not over yet. You can still make history. The balance of power in Georgia voters' hands, whatever side you take, could determine the nation's fate. Your vote still matters. Stay involved, stay informed with journalism that gives you a real voice.
Breaking news, the hand tally of nearly 5 million votes is now complete.
Right now, no matter how you add it up, our cases are rising.
We do have a flash flood warning that just popped up here.
The hand retally, that's done. This is going to a recount, and the taxpayers will foot the bill for a 3rd time.
Morning news should be both informative and fun.
Gone are the days where we're speaking at you. On Morning Rush, we're speaking with you.
So connect with us. Talk to us.
Think of it as a conversation.
Morning Rush, weekdays, 5 to 7 on 11 Alive.
Quick, open your phone camera right now, aim it at the screen to download 11 Alive's new and improved app. This QR code will take you to the App Store or Google Play. One simple tap gives you enhanced radar, street-level zoom, and severe weather alerts. It's just that easy.
As COVID-19 continues to impact our state, the need for food is bigger than ever.
In fact, 1 in 4 kids in Metro Atlanta live in a home that lacks access to adequate food.
But here's how we can take action to help.
The next time you're shopping, grab some extra canned goods.
And drop them off at 11 Alive's Canathon with contactless drop-off December 4th.
Or visit 11alive.com/Canathon for 3 easy digital ways to give.
11 Alive's annual Canathon. With your help, we can stamp out hunger in Atlanta.
Morning news should be informative and fun.
Yeah, and we do that here on Morning Rush with Verify, Connect the Dots, Why Guy, and more.
We love learning about new things and sharing them with you.
We make the news make sense.
Morning Rush, weekdays 5 to 7 on 11 Alive.
The Negro people had to leave. They were told to get out.
White only, no black!
1912, all but one issue has been erased.
We haven't had none up here since the 1st of the century.
What's the importance of making sure this history isn't erased?
So that it doesn't happen again.
Is your morning routine feeling a little routine?
Then mix it up
Morning Rush is different.
It's the fast-paced news you need
with all the energy of your morning coffee.
Come see the difference on Morning Rush, weekdays on 11 Alive.
Weather can't run from the all-new 11 Alive Thunder Truck, a mobile weather center with the power and speed to chase down the strongest storms and bring you on-the-ground conditions. The 11 Alive Thunder Truck, sponsored by Landmark Ram.
Here in Atlanta, bad weather means bad traffic. A few drops of rain could destroy a commute. But that's where my man Crash Clark comes in. I go street level, he goes next level. Together, we make sure you get to work on time. Morning Rush, weekdays 5 to 7 on 11 Alive. Hey, quick, open up your phone camera right now. Aim it at the screen to download 11 Alive's new and improved app. This QR code will take you right to the App Store or Google Play. One simple tap gives you enhanced radar, street-level zoom, and severe weather alerts. It's just that easy.
Journalism that gives you a real voice.
At Morning Rush, that's our commitment each and every day.
And why we're honored to have been recognized for Best Morning Newscast for the 2nd year in a row.
If you haven't yet, check us out. See why we're where Atlanta speaks.
Atlanta roads are my thing. ITP, OTP, Ponce, Piedmont, all the peach trees. Combined with Chesley's street level forecast, that's a lot of tech and experience to help your commute.
Morning Rush, weekdays 5 to 7 on 11 Alive.
We're quite the combo.
The President of the United States was accusing you of voter fraud.
Oh, I know it, and I knew it wasn't fraud.
Mr. James Blaylock voted in the election, the president's campaign tweeted. The only problem, he passed away 14 years ago. False. James Blaylock did not vote. Mrs. James Blaylock voted.
After our investigation, national news outlets owned up to their false claims, and the president's campaign deleted the tweet.
Weather changes can make or break your day. That's why the 11 Alive Storm Trackers are always watching what's coming next, delivering accessible and accurate forecasts that prepare you, not scare you. The Storm Trackers, only on 11 Alive.
COVID-19 is still spreading in Georgia. Now get facts, not fear, at 11alive.com/COVID numbers. Track cases by county using our interactive map and get the latest health department data. Visit 11alive.com/COVID numbers.
A sign of relief across half the nation. The rest feeling devastation.
In Georgia, we can now focus on the 2 Senate races here that are still unresolved.
It's not over yet. You can still make history. The balance of power in Georgia voters' hands, whatever side you take, could determine the nation's fate. Your vote still matters. Stay involved, stay informed with journalism that gives you a real voice.
Breaking news, the hand tally of nearly 5 million votes is now complete.
Right now, no matter how you add it up, our cases are rising.
We do have a flash flood warning that just popped up here.
The hand retally, that's done. This is going to a recount, and the taxpayers will foot the bill for a 3rd time.
Morning news should be both informative and fun.
Gone are the days where we're speaking at you. On Morning Rush, we're speaking with you.
So connect with us. Talk to us.
Think of it as a conversation.
Morning Rush, weekdays, 5 to 7 on 11 Alive.
Quick, open your phone camera right now, aim it at the screen to download 11 Alive's new and improved app. This QR code will take you to the App Store or Google Play. One simple tap gives you enhanced radar, street-level zoom, and severe weather alerts. It's just that easy.
As COVID-19 continues to impact our state, the need for food is bigger than ever.
And then introduce the nurse, and then nurse will get her shot. And then she'll go up this way. And then.
Sorry, I didn't
That's all right. Well, then Dr. Toomey to sit and get her back. And then Dr. Toomey will then exit this way, and Kemp comes up for her.
You can stay.
Lindsay?
Oh, no. Oh, yes, sir.
Everyone's here. Okay.
Just make sure you've got tape in the shot.
You all ready? Well, good afternoon and welcome to Grady. My name is John Hoffert and I'm President and CEO of Grady Health System. It's my pleasure to welcome Governor Kemp and Commissioner Toomey on this most exciting occasion. Today we begin turning the corner on our fight against COVID-19. The start of the vaccine rollout gives us great hope that the end of the pandemic is within reach. Yet we still have much work to do. As we are standing here, we're in a surge nationwide and our hospitals are becoming full. But by deploying the vaccine to frontline workers across the state, we have a new tool to keep those workers safe, and one that will in the coming months make our communities safe again. This is a historic day. We have reached this point thanks to the leadership and partnership of Governor Kemp, Commissioner Toomey, and other state leaders. And I want to close my opening comment by saying how incredibly thankful we are to the partnership we have had with the governor, with the Department of Public Health, and with their staffs that have really helped us weather this storm. They've been of incredible support to the hospital community. So with that, it is my pleasure to introduce Governor Kemp.
Well, John, thank you so much, first of all, for hosting us today here at Grady, and on behalf of your state and all these hardworking folks that are working here today. I just want to tell them how much we really appreciate all that you all have been doing and continue to do and will be doing. We still have a long road ahead of us fighting the virus and getting the vaccine out, but we're grateful to be here, and I, for one, appreciate your leadership and your commitment to helping us work with hospital CEOs all over the state to make sure that we're getting the information we need to make good decisions. And obviously, appreciate all that Dr. Toomey has been doing through the whole pandemic. I know she's probably as excited as anybody today about what we're going to be doing here in a little bit. So I know that, again, I just speak for myself, Dr. Toomey, and our whole team, that we're just grateful for all these folks that are on the front lines of the healthcare fight against COVID-19, and I know we cannot say that enough. But we're also very excited to be here today to roll out the vaccine here in Atlanta and continue to do that throughout the state. And I think you'd be, as I said, hard-pressed to find someone as excited as Dr. Toomey is today. So hopefully we can keep her under control during the vaccine inoculation. But since our fight with COVID-19 began really incredibly over 9 months ago, the people of Georgia have certainly felt the effects of a once-in-a-century global pandemic and health crisis. And while kids and teachers adapted to a changing educational landscape, parents, business owners, hospitality workers, farmers, and many others came to grips with the harsh economic realities brought on by this pandemic, and that includes the hospitals as well. And while our measured approach to reopening, fighting for people and their paychecks, put Georgia in a position to lead the nation in the economic recovery, I know the effects and the threat of the virus have still weighed heavy on so many in our state. This sobering reality has been no more evident than in our hospitals and what these folks have been dealing with literally every day. For months on end, countless doctors, nurses, healthcare staff, they all have made an incredible sacrifice on behalf of their fellow Georgians. Many have and continue to work very long hours away from their families and have taken on much more than they probably thought was possible when they chose this profession. And if you haven't heard it enough today, I want to genuinely say thank you to all of you on behalf of Dr. Toomey and our whole team. We are grateful, and that goes for everyone across this state who are on the front lines of the fight and will continue to be. I also, again, want to thank great leaders like John and his team here at Grady. They have been invaluable to our fight. And I will tell you, who would have known that a flooding emergency just a year ago would have given us a dry run on how to coordinate emergencies in our hospitals throughout the metro region. That experience, while bad that it happened, it has been invaluable in our response to COVID from a statewide perspective. Since then, we have funded the Georgia Coordinating Center to ensure our hospitals in Atlanta and throughout the state are able to rapidly communicate in order to care for Georgians who need them. This team has served as our eyes and ears on the front lines, making us aware of any issues so the state can respond quickly and efficiently to help keep people healthy. We've held regular calls with hospital CEOs and nursing home administrators from the outset of the pandemic. This has helped us maintain an open line of communication during our response. And due to the reality of a nationwide pandemic and increasing demand on our healthcare professionals, one of the key things that they've continued to mention to us is staffing. To date, I can tell you the state has done everything in its power to support our hospitals on this front, with plans to have spent $250 million in CARES funds on the augmented staffing by the end of 2020. And today I have some very exciting news to share. I've met with Speaker Ralston and Lieutenant Governor Duncan, and our office has been working with the House and Senate appropriators to ensure we continue the state's commitment to hospitals and nursing home staff augmentation through March 6th of 2021, which initial projections put us at nearly $70 million. So we're very excited to be able to continue to help our healthcare partners with staff augmentation. And while we are hopeful that our federal partners will move to allow greater flexibility with CARES Act funding, we are all in agreement that this critical resource is vital to our continued fight against COVID-19. These funds will help us shore up resources in our hospitals and our nursing homes and ensure that they have the necessary manpower to quickly administer the vaccine in accordance with the directive from the CDC, while also continuing to provide top-notch care to their patients and residents. As I've said many times in recent days, I know life is anything but back to normal, and we still have a long way to go to defeat this virus. But make no mistake, thanks to the incredible work done by the Trump administration, Operation Warp Speed, and partners in the private sector, we now have hope on the horizon. The work done to develop the vaccine has been nothing short of a medical miracle. This vaccine is safe, it is effective, and it is now on the way to the people of this great state. In the weeks and months to come, just as we took a phased approach to bringing back our economy, we will take a phased approach to vaccinating the Peach State and finally defeating COVID-19. As we approach Christmas and the balance of the holiday season, it is important that the people of Georgia remain vigilant. This is going to be a heavy logistical lift for the state. We have never undergone such a large mass vaccination campaign in our history. And just as there has been in each new chapter of the pandemic response issues, there will be challenges and hurdles that we have to clear. So we would like to ask for your patience as we work diligently to continue to roll out the vaccine. Due to very high demand and limited supply, as you know, we will not be able to vaccinate the general public for months. That is why it's so critical that all Georgians continue to follow the guidance and best practices that we've been talking about for months now. We are beginning to vaccinate the vaccinators, our frontline healthcare workers right now, and those that are in the long-term healthcare facilities. Out of respect for these heroes and your fellow citizens, we need folks to continue to hunker down and keep following the 4 things for fall as we move into winter and help us limit the spread of the virus. Wear your mask, wash your hands, continue to socially distance, and continue to follow the guidance of public health officials outlined in our executive orders. Over the last 9 months, Georgians have stepped up time and time again, and we need their continued support for just a little while longer as we work to administer the vaccine as quickly as possible. Believe me, I know that people are tired and ready to return to normal. I am as well. But we are too close to winning this fight to give up now. If we continue to do these simple things for the next couple of months, wearing your mask, washing your hands, practice social distancing, follow the guidance, we will get through this together. And we will finally see this long national nightmare come to an end. Thank you again for being here today. Thank you for helping be a part of the solution and not part of the problem. And I wish everyone a Merry Christmas and Happy Holidays. And with that, I'll turn it over to Dr. Toomey to make a few remarks. Thank you.
Thank you, sir. I'll try very much to curb my enthusiasm. I've been on the phone with many of my colleagues, both in the medical care community, the public health community, the general Georgians throughout the state, and there's really a light. It just feels like a lightness in everybody's mind as we recognize that there is a light at the end of the tunnel. This has been a very long year. It has been hard for everyone in Georgia, but particularly so, and a shout out to all the health professionals, whether you're hospital-based, whether you're community-based, or my colleagues in public health, who literally have been working tirelessly to ensure cases are identified, interviewed, and we had ability to test everyone across the state if they needed to have COVID tests. As the governor so rightfully said, I am thrilled and that I and be among some of the frontline workers who will be vaccinated today, because this will be the tool that helps us get through this pandemic. But we need everyone's help, not only to continue the four pillars for protection, including wearing a mask, social distancing, washing our hands, following the public health guidelines, but also getting vaccinated when the time comes, when the vaccine becomes more available to everyone. This vaccine is safe, it's effective, and it will be the tool we have to finally be able to go back to what we think about as our Georgia lifestyle. And I really want to thank all of you for your support for us during this time, as we have really worked hard to ensure the safety of all Georgians. And now I'm trying to curb my enthusiasm, but I'm standing in the way of my colleague getting her vaccine. So, and I'm right behind, so I'm going to move. Thank you, everyone.
All right, well, thank you. As you can see, Dr. Toomey's excited. And I'm excited too. Look, it's as many challenging things as we've had to deal with and still have to stay focused on with a lot of what we're focusing or what we're dealing with over the last several weeks. It's sometimes hard for me to get excited because I'm definitely staying on task for the mission at hand. But this is an exciting day. It's an exciting time. It's a medical miracle, and you're seeing it right now before your eyes, and it gives us all great hope in a season where that's what we should be talking about. And I'm very excited to introduce Norma Poindexter. Norma has been caring for COVID patients throughout the pandemic. She's worked here at Grady for nearly 20 years, and she is going to be the first ICU nurse at Grady to receive the vaccine. And Norma, we're excited. But we also owe you and your colleagues in the hospital and all across the state a debt of gratitude for your just unbelievable service to your patients and to Grady and to your state. So thank you very much, and congratulations, and thank you for being willing to do this today. Norma Poindexter.
This many people watching.
You're a star.
At least you don't have to shoot a free throw or anything.
That's all right.
Or throw out the first pitch.
Thank you, Miss Linda. That was good.
All right. Well done.
All right. Thank you.
Oh, there you go.
Yeah, that's awesome. I got mine.
What does it say?
I got mine.
Great. Thank you, Norma.
You're so welcome.
All right, Dr. Toomey, you're up.
Steve's going to give it to you.
I was going to say.
I was trying to get to do that.
I'm going to give it to myself.
I always squinch up my face. Very good. That's good. Your star.
Dr. Toomey, can you talk about kind of your emotions right now?
I am so relieved and so excited to quote the governor. I think because I see, the weekends start to save lives, prevent some of the suffering that so many Georgians have had to endure within their own families, with their friends. This has been an incredible toll on Georgia as a whole and on the healthcare community. I mean, I think that people don't understand how difficult it's been for everyone here at Grady and all of our hospitals working night and day with COVID patients, working in the community and for public health as well. And so I am just, as I said, I feel like we have this ray of hope that we didn't have even a few months ago, and excitement and a real re-energized sense that we will get through this, and we will get through this together, and we will be able to keep people healthy and save lives. Okay, I've got to sit down and do my 15 minutes of silence. Thanks, everybody.
Dr. Toomey, we got to get you, they got your button for you.
Oh, okay. So we're going to get under your 15 minutes of
All right, anybody got anything else?
Governor, can you just talk about your emotions? I mean, it's been the longest 9 months of my life since all of this started. Remembering back when you first convened the coronavirus task force.
Oh yeah, it's it's almost overwhelming, quite honestly. You can better appreciate that, I think, coming from Dr. Toomey. I mean, these folks have been on the front of the healthcare crisis and COVID the whole time. It's been miraculous what they've been done. I can only imagine the relief that they have, or that they will have when they get the vaccine, knowing that they're safer doing their job, which, I'm just glad they're prioritized. I mean, I never had a doubt that they were. So it's, it's really an awesome moment, and it's amazing that it's here this quick. I don't think the president and the task force and Operation Warp Speed have really gotten the credit they deserve. Along with the private sector, a lot of great scientists and researchers that have been working on this. The people in Georgia, our own citizens, our own neighbors that were taking part in the trials, really risking their health in doing that, and we owe them a debt of gratitude as well. But for me, we've got to keep our foot on the gas. We have a lot of work to get the vaccine distributed, especially after we work through healthcare and nursing homes. I mean, they're all working in one location. They're there every day or most days. When we get to the general public, it's going to be a different logistical lift that we have. So we're continuing to focus on that, and we're also waiting on more federal guidance, and that's why I pleaded for people to have patience. When we get to that point, we know, like testing, we'll probably have hiccups. We'll just have to fight through that and keep moving. But the good news is it's here, and we're going to do everything in our power to get it out just as quickly as we can.
Governor, you mentioned the $70 million additional spend to help nursing homes, hospitals deal with this. The hospitals we've talked to report increasing capacity issues, staff shortages. Is the $70 million going to be enough to help those hospitals and nursing homes?
Well, we feel like it will. We've been working with them on that. I would continue to make clear to my fellow citizens out there and the media, one reason the hospitals are so bad. Look, there's no doubt we're having an uptick in COVID patients right now. Our numbers, obviously we're having a post-Thanksgiving bump. We've got to continue to urge people to help us solve that problem and don't gather as we go into Christmas and other holidays that people are celebrating. This time of year, cut those, limit them, wear your mask, just be smart. Let's try to flatten the curve and slow the spread down. But we also know that hospitals are very busy with other non-COVID related. I think any of them would tell you that. That is the business model to keep them open. Back during the shutdown, that was impossible for them to do, and it almost cost many of them financially. I mean, we were at the point where we were about to bankrupt our hospitals by being shut down. So there's a lot of bandwidth still in the hospital. It may not be the best financial model for them, but that's something, I mean, that's why, and I can let John speak to this, but that's why we have constantly, whether it's me doing the calls with the CEOs in the metro area and other parts of the state, or whether it's, our staff literally talking to them daily, working with the coordinating center. And I don't know, John, if you want to add anything to that.
I think Dr. Hubbard will be interested in just the state of things at Grady in particular.
Sure. Well, back to your question about the supplemental staffing, the state has really stepped up and assisted a significant number of hospitals across the state, including here at Grady. We have had supplemental staffing to help us during the surge periods with COVID. But even most recently, we've been talking with the state about how we can open up some of our surge capacity. Areas that normally aren't open for inpatients, but that we have designated and have available to kick off when we need that surge capacity, and the state has stepped up every single time. And so I can't answer if $70 million is enough, but I can tell you it's been a real collaborative relationship. And the only other thing I would add is the CEOs in the metro area of the health systems meet via phone or WebEx with the governor on a regular basis, and we talk about if there's issues with PPE, if there's issues with capacity, if there's issues of any kind related to caring for COVID patients. And early on in the pandemic, hospitals were running into issues with different types of PPE equipment, and the state and GEMA stepped right in and assisted hospitals with that as well. So it's been a wonderful relationship.
What is the status here right now in terms of coronavirus? I know that the hospitalization rate statewide is higher than it was this summer.
Sure. It's interesting. The hospitalization rate is higher. In the metro area, it's not higher than that original peak. We are seeing more increases in cases outside the metropolitan area. Today at Grady, we have 74 COVID inpatients, and that's in addition to everyone else we provide care for. And so one of the things that has happened in this peak is, as the governor stated, when we shut down all of our essential and elective procedures, that created a lot of hospital capacity at that point to care for COVID patients. Well, those volumes have come back, and so the hospitals started off going into this peak fairly full. And so it's a different event this time.
Governor, as we go into the Christmas season, the message that you gave us before Thanksgiving is the constant one you've given about personal responsibility and Georgians needing, it's the same one you just asked for, the vaccine is here, but hold on. But with the spike we're seeing, does more need to be done? Does the message need to change? Does more need to be restricted to try to avoid this again in January?
Well, I think, in the past we've had that messaging and it didn't work, and people let their guard down and we had a spike. And then we went into the next holiday and people did listen to us. It worked. We didn't have a spike. So I'm hopeful that for those that thought maybe at Thanksgiving, well, it's not that big a deal and it's going to be okay. I'm hopeful now that they'll really help us over the next, whatever it is. I'm losing track of time. We've been so busy. But going into Thanksgiving, just here in the next week or a little over a week, to really just don't go out unless you need to. If you do, just wear your mask. Try not to go to things that you don't have to stop the spread. Limit your family gatherings for the holidays. Just be smart when you're doing that. I've always liked to have a little cool weather at Christmas, but I'm almost hoping for a heat wave where people can eat outside on their patio or on their back deck in light of COVID. But I think people can, we've done this before. Our guidance has hardly changed in a very long time, so we can deal with it. Our hospitals have a lot better treatments and options now than they did. The stays are not as long. We got to continue to focus on protecting the most vulnerable, the elderly, medically fragile, those that are in our nursing homes and long-term care facilities. But the thing for our younger population is you don't want to take it and spread it to those folks. That's where you see your fatalities starting to increase, and it will not make for a good holiday season if that continues. So we just need everybody to focus and hunker down and follow the guidance.
And what's your message to people who are afraid to take the vaccine? I think we've maybe all heard from friends, family members even, who are nervous about this.
Yeah, and I'm hearing some of that too. I think the more people that take it, and the more we got to continue to publicize that. And I want to thank Norma Poindexter for her leadership today and willingness to take the vaccine, as well as Dr. Toomey. I think that will give great public confidence that you have somebody that has the resume of Dr. Toomey working in epidemiology and public health, literally all across the world, depending on what her duty was at the time, and all across the country. She was telling me the other day about her time in Alaska. So she's literally done this from sea to shining sea, and I think that will give people great confidence. I'm going to get the vaccine just as soon as I'm eligible and people think it's a good idea for me to do it. I don't think it's a good idea for me to get it before Norma and her colleagues. We got to protect the people that are on the front lines. That'll help John, I think, with the staffing situation where they don't have people in the hospital getting COVID and have to stay out of work. That helps us on the staff augmentation. But we'll continue to send that message that, look, this is safe, this is effective. There's been a lot of really smart people, including people in our own state, that have participated in these trials and have worked on this vaccine. And I'm very confident of that.
Governor, there's a report, I think, out of Iowa that states are being notified that they may be getting less vaccines than originally promised, as much as 30%. Have you received that call? Will this coming Moderna help flatten that out?
Well, the coming Moderna is certainly going to help, and so will the other vaccines that will hopefully be coming sooner rather than later. But we got to let that process, go through all the safety protocols and get to that point. What I do know is this week we got 84,000 doses of the Pfizer. Next week we're going to get 174,000 doses of the Moderna vaccine. And then it looks like next week with Pfizer, we're going to get around $60,000, and that is a little bit smaller amount than what we originally were told. I think it was right at 99,000. But it's, I keep telling people I wish it was a lot more, but it could be zero right now if we looked at, past vaccines. So I'm thankful that we got the 84,000. I'm thankful that we're getting around 250,000 doses next week that we can continue to give to our frontline healthcare workers and other people that meet the 1A criteria. And that is a great thing for our state. We got to start somewhere, and we're started, and we got to keep it rolling.
And Governor, will there be any talk about any sort of vaccine requirements for certain workers, certain people in high-risk industries?
Well, we're continuing to have those discussions, not at a very high level. I mean, look, we got enough people. We got more people wanting to take the vaccine than we got to give right now. So we'll start worrying about that when we get there. I think there's going to be a lot of public confidence the further we go down the road. And I think for one, let's go down that road before we start having those discussions.
Cool. I'm going to ask one more quick question. How do we know when we're going to transition from 1A to 1B to 2A to 2B? Who makes the decision?
Well, I think that'll be guidance that's coming from the federal government. I know our team is staying in touch with them, daily, weekly, so we'll keep you posted on that.
Thank you, everyone. Thank you, Governor.
I did, but, and then I was like, don't worry about it.
I forgot to ask. Yeah, we're good. I ended up parking on the street because I couldn't get into the
Thank you.